Hi everyone, my name is Jennifer Green Wilson and I'll be an instructor for the next couple of presentations as we explore different roles that physical therapists and occupational therapists assume in contemporary clinical practice. This particular presentation will be talking about the different roles as leaders, managers, administrators, and supervisors in healthcare. When we think primarily of our roles in clinical practice, we tend to think of as a clinician. And currently, right now, if you look at this Venn diagram, you right now as a student, you're pretty focused on how can you be that great clinician. In addition, though, looking at all these other roles as occupational therapists and as physical therapists, you can assume all of these different roles at different times. So, as an educator, a researcher, an administrator, or manager, or supervisor, consultant, and also leader. And the thing that's interesting is when we start talking about the role as the leader, we can also add that role as the advocate for patients, clients, and for society. So, what we're discovering though, and this is why when we start talking about these other roles, is that within physical therapy, for example, we have progressed to a clinical doctorate degree as our entry level degree. But healthcare as an industry continues to keep changing at very fast pace. And so what we're seeing is despite moving to this entry level degree that's at a different level, we still have a gap in our skills and knowledge needed in physical therapist practice or in occupational therapy today. So, what employers or what healthcare needs right now, we're still trying to catch up in terms of some of the knowledge and the skills. And so, basically, a lot of the roles that you saw in the Venn diagram, these leaders, managers, administrators, supervisors, when we start to try and figure out, well, what are the skills that we're missing? What's the gap that we have to try and fill? It's related to these different roles. And so, what I want you to do right now is, as we go through this presentation, but try and think of how do we define the difference between these different titles or these different roles or these different levels of responsibility. So what is kind of interesting is so I one of my degrees that I have is I have an MBA, and so I studied a lot about pure business kind of business management content. And in healthcare, we tend to shy away from these concepts of healthcare as a business. Many of us come into clinical practice because we want to help people, and that's our main role. But the thing that we have to understand is healthcare is a business. It is a big industry. We spend a lot of money trying to provide healthcare. But terminology, we tend to shy away from, the true concepts. So we call this thing called practice management to really represent sort of the business aspect of clinical practice. And the thing that we have to understand is practice management is absolutely essential. It's part of healthcare clinical practice. It's defined as the coordination, promotion, and financial and human management of clinical practice that follows regulatory and legal guidelines. So, physical therapists and occupational therapists are responsible for the direction of physical therapy and occupational therapy services. So, we are the managers, we are the supervisors responsible for the direction of care. And so, these aspects, part of our fundamental roles, even as clinicians, because we're responsible for the direction of the providing the care, direction and supervision are essential responsibilities that we are responsible for every single day. So I know from talking with your professor, you'll be talking more about delegation, but I wanted to at least draw the link between, as occupational therapists and as physical therapists, you are responsible for the direction of clinical practice, and so you will be responsible for delegation. So then talking about effective administration. So this was one author or one researcher and way back when. So I just want to share with you sort of the evolution of these words, this terminology that we're talking about today. So administration was sort of the category, the responsibility, any sort of formal group of managers or administrator who had those titles or those job roles. So in the 70s, though, people started really trying to figure out, okay, so for effective administration, what are the skills? What's the knowledge? What do these people who are administrators have to do? And then what do they need to know? So this study that was done way back when was very helpful in terms of defining sort of the adequate levels of different skills. And so Katz determined that effective administrators had to have technical skill, human skill, and conceptual skill. And I like this model because I think it really helps us to understand, even in our roles as clinicians, moving into being responsible for some of these other aspects of management. So, the technical skill obviously is the ability to carry out tasks, procedures of a particular job or role. So, that can be our technical skill or clinical skill. The human skill is the ability to lead and work effectively in a group situation, which we all have to work on teams. And in fact, working more effectively on interprofessional teams is becoming more and more important. And then this conceptual skill is the ability to view the organization as a whole or big picture and to see interrelationships among various functions or factors involved in situations. So the systems view, which I'll talk about in a few minutes a little bit more. So in the 70s, late 70s, we started to talk about and define, well, what do we need to get effective administration? Well, then what's happened is we then started defining more about what's management. And now the current conversation is really focused on what's leadership. And I like this model. This was an author, Blanchard, who talked about a real simple way to understand the difference between leader and manager is the manager really has the head down kind of role. So making sure that everything's coordinated, that you come in, you're managing your schedule, it's not chaotic, people know where they're supposed to go, you have that schedule, people are supposed to arrive at a certain time, or you're supposed to go someplace at a certain time or whatever. But you really need to have some kind of organization, some kind of coordination so that it's not chaotic and so that everybody can be efficient. So the day to day can be that efficient kind of schedule. The leader is really all about the head up. So, really looking forward. What's next? What's around the corner? What are we going to do next year in terms of, some of our goals, our strategy? So, leadership and management are different and they're both really important. So, management defined as organization and coordination of activities of a business of clinical practice in order to achieve defined objectives. And quite often we organize different activities by function. So there might be a marketing function, there might be a human resource function, and then managers can also be the people who have that formal power and responsibility to make decisions to oversee that entity. And so again, just so you understand, management is not leadership. Leadership is not management. They're two different things. Both are really important. So, a few management theories that I wanted to share with you. So, again, we started in the 70s talking about administration. In the 80s, we started talking more about management. And now we're talking more about leadership. So, management theories are used to or applied to increase organizational productivity and service quality. So, to really make sure the entity runs well, is efficient and effective. And so these different theories, I wanted to share with you contingency theory, chaos theory, systems theory, and theory X and theory Y. So these are some of the classic management theories. Contingency theory is basically saying that managers make decisions based on the situation. So it's not just one size fits all. And this model that you'll see, the situational leadership, it's a great model if you move into a formal role as a new manager early on. And basically, what it's saying is what was great about the situational leadership model, it started to look at it wasn't just how the leader or the manager wanted to make decisions, but it was really starting to look at what did the people need at that moment in time. So, for example, if you look at the directing over in the S1, if someone was new to a role, so again, going back to this delegation, if someone was new to a role, then basically the manager would direct more or help that person sort of tell them what to do, versus later on, if someone was more capable, then they can get into that role of delegating. So, decisions, the type of decision, the type of coaching, the type of help that the manager would give the people that they're working with would depend on the situation, depend on the needs that would make sense. Chaos theory is really related to this whole underlying concept that change is constant. And if you look at healthcare, we're changing all the time. So it's not something that, oh, we're at status quo and then all of a sudden we have to change, but it's really starting to look at that change is just constant. And so basically, what it's saying that change is inevitable and it's rarely controlled. So we have to figure out how we can become more adaptable so we can respond with greater agility to change. And so this whole concept of sort of understanding how change is inevitable, it's constant, we can't really control it, but our job is to figure out how we can evolve and change so that we can keep up with the change that's happening or the evolution that's happening. The systems theory applies really well to healthcare. And basically, it's saying that all of us, sort of our patterns and our events, we're all sort of one big system. And, we tend to call big organizations that we're working in right now these healthcare systems, where a patient can start in one function within the hospital or within the system, and we can basically take care of their needs throughout their whole lifespan. So, this systems theory is really trying to look at, and again, sort of this big picture, how do all these little parts all sort of interrelate? And I like to tend to think of, if you look at dominoes, right? If you touch one domino, line them all up, they can all sort of fall down and create this really cool kind of effect. But understanding that we all depend on each other, and so that we really have to be able to coordinate what we're doing in order to be effective and efficient in providing our. So, theory Y and theory X. This was looking at from a management style, and the management style was really influenced depending on how people believed or their beliefs about worker attitudes. So, for example, Theory X, managers who tend to adopt more of a management style related to Theory X believe workers naturally lack ambition and need incentives to increase productivity. So, in this particular case, managers use more of this authoritarian style or more directive kind of style. Theory Y believe that workers are naturally driven and take responsibility. So, managers who tend to have more of this Theory Y really encourage participation and interaction from workers. So, how you interact with your team would really vary depending on your beliefs about your team's attitudes. So, in essence, when we start to really look at, well, what's the difference between management and leadership? And again, it's been probably 20, 30 years of lots of people trying to define this. I thought this was a really great way. Again, think of the head up, the head down. So managers administer, or they're responsible for that coordination and control. Leaders are responsible to innovate, so that change. Managers maintain, leaders develop, create. Managers accept the status quo, leaders challenge it. Managers focus on systems and structures, how to organize and really make sure that everybody knows what they're doing, have that schedule. Leaders focus on engaging and empowering people. Managers rely on control, leaders inspire trust. So they're more focused on those relationships with others. So Gerber, he's written a lot of books related to this whole concept of being an entrepreneur. And I thought this quote really helped to capture sort of how we've moved the conversation from the 70s related to administration into management and into leadership. So, understanding how change requires leadership, change requires leaders to be responsible for looking for that forward view. So, he suggested, and this was in 1998, to be a more successful manager in tomorrow's more enlightened, more intelligent, more human, more conscious organization. It's going to be markedly different than it is today. So, again, drop this into healthcare. Healthcare is changing so fast. So, in a more conscious organization, a manager is less a traditional manager and more of an entrepreneur, a creator of things, a conductor of an orchestra, an inventor, and a leader. So, characteristics of admired leaders. Kouzes and Posner wrote a great book, The Leadership Challenge. And so, what they've done is over many years, they have surveyed people to determine, if you're talking about leaders that you really admire, what are the top 25, top 50 different characteristics? And consistently, the characteristics of admired leaders, number one is honesty or being trustworthy, forward looking, inspiring, competent, so that they do their job well, they know what they're doing. And then intelligent is number five. And so the definition of intelligence is, there's IQ and then there's EQ. And what the evidence is saying at this point is effective leaders all have a high degree of what is called this emotional intelligence. And so that's just giving you a snapshot of different roles, different responsibilities that you will have in practice every day in practice.